Okay, in this video I'm going to walk you through some of the structural parts of the knee. Okay, so we have our knee here. We're looking at the front side of it. I can tell you that right off the bat because you can see covering the knee would be the quadriceps tendon, and then running down past the knee into the lower leg is the patellar tendon, and then behind there is the patella. Now that's not stuff that will be covered on the exam at this point, but we will cover that stuff later in the semester. So looking at the three bones involved here, we're not going to include the patella. We have the femur, the big upper leg bone, then you have the big lower leg bone, the tibia, and then the skinnier fibula. Now remember, tibia is always medial and the fibula is always lateral. That's going to help us for identification of the various ligaments and some of the two meniscus or menisci for plural. So I was already touching on this. This is the lateral collateral ligament. We abbreviate that the LCL, which is also kind of known as the fibular collateral ligament, as they're kind of trying to go to that in the textbooks nowadays. You'll probably never see it in real life known anything else other than the LCL. Kind of the same thing goes for the MCL, which goes down from the femur down to the tibia. The MCL, or medial collateral ligament, gets its name for the fact that it's medial. It's also called the tibial collateral ligament. So if kind of centered up here again, we can see these two pieces of tissue there and there. And if I kind of open things up a little bit and look in, you can kind of see that they have kind of a C shape to them. Those are the meniscus cartilages. And so since we're looking here on the fibular side, this has to be the lateral meniscus, and that makes this the medial meniscus. Okay. On the inside of the knee, if I kind of open it up a little bit, is where you can see the two crossing. If I kind of move that out of the way, you can see the X shape to show off the ACL and the PCL. Okay, the ACL is the anterior cruciate ligament. You can see it nicely there. And then in behind, kind of tougher to see there, the darker thick band there is the PCL. So ACL standing for anterior cruciate ligament, PCL for the posterior cruciate ligament. And that's pretty much the gist of the knee. Thank you.